So people always say things like, oh, all these people doing cosmetic surgery, they're changing the way God made them. I say, which way did God make you? I have these things that I think about sometimes, and I just ponder. One of them is cosmetic surgery or aesthetic surgery sinful? Since we're talking about faith and medicine, is it a sinful thing to do? Does cosmetic surgery defile a man or a woman? You know, the reason, why did I think about this? Years ago, there's a church we used to attend as a family. I have to say, first of all, I'm an Anglican, born in an Anglican family, true Anglican. But the Anglican, I was born in Nigeria. Now, the Anglican worship in churches in Nigeria is quite warm. It's very warm. You see bits of everything that you require in a church. As my father, those who know me know my father. My father, blessed memory, was a bishop. And he used to say things like every church should be traditional, Pentecostal, evangelical, and also charismatic. So we saw this in the Anglican church. But when you move to the West, quite a few of the Anglican churches were quite, I don't know the word to use them, they were not really that warm. So sometimes you go to church, you don't really get that feeling that you've been to church. We go to a good one now, a very good Anglican church we go to now. But during that period, we didn't have one. So even though I'm an Anglican, when people invite me to their own service, if it's a Pentecostal church, I will attend if I'm free, or we attend as a family if I'm free. So during that period, there's one we used to go to them. Sort of started enjoying going to that place from time to time. And this church, they were doing some kind of business. They were producing quarterly magazines. Because this church had about 5,000 to 10,000 people who attended through the services. They're members up to 5,000 to 10,000. That's a good audience. And they said they wanted people who had businesses to advertise in the magazine. Now, as a consultant plastic surgeon, I do have my NHS job, my government work, but also I do have private practice. And in my private practice, most of what I do is like cosmetic surgery. Things like breast enhancement or breast enlargement, tummy tuck, liposuction, things like that. Those are the kind of things what I do in my private practice. And obviously that's like a truly limited company. So I said to myself, well, that'd be a good place to actually advertise my work. So I made what I thought was quite a tasteful advert and paid the money. And then it was rejected. It was rejected by the board or whatever, the pastor and the board, who were deciding. And when I asked why, they said it has to do, I was showing about things like breast augmentation, breast implants and things like that. And I'm thinking, oh, so it's okay for me to bring my offering to the church from doing breast augmentation and a tummy tuck, but it's not okay for me to advertise the work there. I didn't know. I looked at them whether they thought I was a thief. I just stole money when I brought my offering. So it made me begin to think, okay, I don't go to that place anymore. But the thing is, I begin to think, why would somebody actually think it is sinful? You know, okay, let's go back. What is actually cosmetic surgery? I think it should be called aesthetic surgery. Now, cosmetic surgery is a part of plastic surgery where the focus is to enhance certain aspects of the body to make it more aesthetically pleasing to the patient. When there's actually, somebody couldn't say there's an actual medical need for that. What we say, just improving the quality of life. Cosmetic, that's called cosmetic surgery. While reconstructive surgery, which is the rest of plastic surgery, is more when you're trying to restore function and normalize appearance. In fact, the word plastic surgery comes from, the name plastic surgery comes from the Greek word plastikos, which means to restore, to mold, to restore back to normal. So plastic surgery is an umbrella term for cosmetic surgery, reconstructive surgery, whatever you call it. Actually, I have an issue with saying that cosmetic surgery is just for appearance, not really for function. Because I think that there's a very thin line between function and aesthetics. In fact, there may not actually be any. If you think about it, I do believe that aesthetics or cosmetics is part of function. Many people live their lives based on the way they look. Look at models. They live their life based on the way they look. If you go to like film stars, some of the very famous film stars like in Hollywood, it's based on their appearance. The fact that they can say certain words on TV, if they lost their appearance, no person will cast them. Or no person will write anything about them anymore. Cast them in movies. So, in fact, studies have shown that very attractive people are 40 times more likely to get jobs when compared to less attractive people. So it's quite clear to me that somebody's appearance, the appearance of any particular part, is part of the person's function. Because if the appearance was not an important part of function, why do people actually dress well? Both men and women. Okay, let's just remove the surgical part of it, starting from the head to toe. Men dye their hair, women dye their hair, women wear wigs, they braid their hair to look nice, different kinds of hairstyles. Why? They put on makeup, lip gloss, everything. Wear very nice clothes. Because when they wear nice clothes, oh, you're looking nice and things like this. These are forms of enhancement. People are enhancing their appearance. They package themselves very well. Can't somebody say, well, it's not that important? It's part of their function. In fact, some people actually say when people look good, they feel good as well. We shouldn't, I don't think somebody will say because there is no physical problem that you're seeing that is not a real problem. Then somebody can then say people have mental illness, don't have a problem. Because they have a problem, even though you cannot see it. Diseases of the mind or problems of the mind are real. And it's real to those people who are suffering it. So, going back to what I'm talking about is cosmetic surgery. Is it sinful? Now, or aesthetic surgery, is it sinful? Now, some people call everything plastic surgery. Once you mention cosmetic surgery, oh, plastic surgery, it's plastic, it's plastic. Plastic surgery is so much bigger than cosmetic surgery. In fact, cosmetic surgery is a very small part of it. So, okay, so I began to think of it the same. Then the example that came to my mind is, if you're somebody who was born with a problem, you have a child born with a problem that can be corrected surgically by a plastic surgeon, and you can afford it, will you take your child to the plastic surgeon for them to correct the problem? Or will you say, will you just leave it? You know? Because the reason I use that as an example, some people always say things like, oh, all these people doing cosmetic surgery, they're changing the way God made them. I say, which way did God make you? You know, if you have a child with that problem and a plastic surgeon can correct you, would you go to the plastic surgeon or not? Or will you just keep it and say, oh, that's the way God made them? Like a woman, if you're a woman born with practically no breast, what's called hypoplasia, very, very small breast, just nipples, and you're very disturbed about it, and you can afford it, will you go for breast implants to enhance it, to make them bigger, or not? Or you have a child born what is called congenital breast asymmetry, where one breast is so small, the other one is so much bigger, and it looks odd. Now, you can say that's a form of reconstruction, but anyway, it's the principles of reconstruction being brought into cosmetic surgery or cosmetic surgery being brought into reconstruction. But in the end, we use some form of breast augmentation to try and correct it. We do what's called a differential breast augmentation, where you take a big implant and put in a smaller one, and the small implant to the bigger breast. Or use what's called tissue expanders or breast expanders to stretch the skin. So these are things that can be done, which you can say so parts of cosmetic surgery. If you have a close relative who has this problem and you can afford it, would you take them to have that corrected or not? You know, these are questions we need to ask ourselves, because some people who may not have had this kind of problems may just pontificate from a very righteous point and say, well, all this cosmetic surgery, what is actually cosmetic surgery? You know, can surgery actually defile somebody? Now let's go back. If we're talking about faith and medicine, I remember Jesus Christ, when his disciples, the Pharisees came to him and said to him that his disciples, the other time they ate food without washing their hands. And he said to the Pharisees, so what's that problem with you? That's your tradition. Why are you disobeying the laws of God? Because of your tradition. He said they're not getting defiled. And then when in the private moments, the disciples asked him this question. And he said to them, are you so dull that you can't even understand this? That what you eat enters your mouth and goes out. You pull it out. But what defiles somebody, what comes from the heart? The thoughts of murder, things like adultery, sexual immorality or fornication, theft, false testimony, slander, all the things come from the heart, just from inside. It can't come from outside. So when you think about it, can surgery really defile somebody? So it has to be what is actually within the person's heart that made them want to do the surgery. If you think about it. So cosmetic surgery is sinful. And the reason I say it because if people are having like cosmetic surgery because of a problem they have, I'm going to go back again to people who have some problem from birth. Can you actually say anything is wrong with that for them to seek that? I remember the man who was born blind in the Bible. And the disciples were saying to Jesus Christ, who sinned? Is it the father or the mother or this person? And Jesus Christ said, no person sinned. Rather for the works of God to be displayed. Now, so that even though God allowed this person to be born blind, he had it in mind, a provision that there is somebody called Jesus Christ or a disciple or somebody like him, which is really what we should be as Christians, to get the person out of that problem, which means that the will of God is always to heal. Because Jesus Christ is the human representation of God. So he said, I am my Father one. I do what I see my Father doing. So it means that God wanted this person healed. Wanted the person healed. He wanted the person whole. Therefore, if somebody has that problem, like the example I gave of the girl born with a congenital breast asymmetry, where two breasts are two different sizes, much different between the two, and they have to go to a plastic surgeon to have this corrected, it can be sinful. Or is it sinful? Because if you have a problem, remember one of the videos I mentioned that the way I look at healing is if you have a problem, something happens, is corrected. So in between, it's either somebody has prayed for you and suddenly you develop new breasts, or a surgeon or a doctor has done something on you, and at least even if it doesn't go back to normal, it looks fairly normal for the person to function. So if you look at that, so even God himself, Jesus Christ said, for to display the works of God. What are the works of God? The wisdom that doctors use to treat people is obviously not given. It's not given by Satan. It's not given by Satan. Now, even if you take this thing even further, there are people who have this condition. Remember, there has to be a balance. For example, there are certain kinds of surgery I, as a surgeon myself, dislike. I actually don't think it is right. But even though I don't think it is right, is it sinful to do them? This question I keep asking myself. Because what has been done from the outside can actually defile a person. Depends on the reason they had it done. For example, some people request certain kinds of surgery because they have other problems they don't even know. I mean, I don't want to go into a different kind of worms about people changing what they are, things like that. But that's what I have in mind. Okay, even thinking about what problems people have, like some people have what's called BDD, body dysmorphic disorder, where they do have an exaggerated concern about a small problem, or about no problem actually. This is an anxiety disorder. So you may have somebody who has a part of their body which you call normal, but they want it enhanced or something done to it, which you regard yourself as a surgeon, and this is actually deforming to the person. It does not make sense. So they keep coming back for more surgery. Now, even if this person is having those kind of surgeries, and to us as human beings, we look at it and say, oh, this person is crazy. Is that a sin? Because they have an anxiety disorder. You're like somebody who has an infection, and you say, oh, this person is sinful to have an infection. They have an infection. The fact that it's not an infection or can treat with antibiotics or sort of pain you can treat with a painkiller doesn't make it less real. People who have BDD, a dysmorphic disorder, is real to them. It's a real problem that has to be treated. So does that make it sinful? So there's so many things about this. I'm sure people have different takes, but you hear this all the time. People talking about, oh, is it not cosmetic? Is it not plastics? Is it not plastic? Is it sinful? As I sit back and I just wonder, most of the examples I've given, I've used maybe problems that happen to people at birth, so that people are not going to begin to argue and say, well, they caused the problems themselves. But how about people who didn't have problems at birth, but they want an enhancement or improvement of certain parts of their body for whatever reason? Why is that wrong? Why is that a sin? For example, say a woman has an unusual body and she wants liposuction to smoothen that area out. Well, why would that be different from somebody who's wearing like spandex to hide the fat? If it's not an issue, man, that's why just allow the fat to flap about. No, that's why they want it. So if those who can afford it and have the courage to go through the procedure, come for it. I don't see why that's a problem. You see, I've used some extreme examples, like people who have a body dysmorphic disorder. But I can say categorically, most patients who come for cosmetic surgery do not have anxiety problems. They're just like any other person, men and women who want a particular part of the body enhanced in its appearance for whatever reason. They don't have anxiety issues. They're normal people with no mental issues, and they want this thing corrected. So I think this is my own opinion, and people have different take on it. It is neither sinful for people to request cosmetic surgery, nor is it sinful for a surgeon like me to do it, to have any issues about doing it. The issue or the problem is always in the heart. The motive is not in the surgery itself. There are so many aspects. I'm only giving examples with the breast. One of the ones that's very topical now is not really topical, that people really laugh about when they're cosmetic surgeries. Brazilian butt lift, BBL. For those who don't know what it is, when people take fat, as plastic surgeons, we take fat from parts of the body, usually the tummy, there's so much, or from the thighs, and we put this fat, we take it by liposuction and put it in people's backsides to enhance it. Now, I myself, I do not do it because not that I see anything wrong with people who want to do it. Again, I think the problem is coming from people's heart, the motive, why they do, why the reason they're doing it, not the surgery itself. Because, they're only just enhancing a part of their body. The reason I don't do it because it's been fraught with so many complications that, in fact, I remember 2 people from the UK had it done in Turkey, and they had complications and died. So generally, our parent organization, the British Association of Plastic, Reconstructive and Aesthetic Surgeons, put out a warning about it, and I just decided, I don't want to do this. But people who do it safely, I don't see any problem in it. As far as it is done tastefully and it is done within what looks normal. Just the same way somebody who has no breast can enhance it. Some people may not have enough back and they want to make it bigger. And but I think all this is going in fashion. That's when I think about it. There is a fashion that is going on. And for example, growing up, I remember reading a book about, growing up in Nigeria, I remember reading a book about fattening rooms. There's actually a particular ethnic group, and what they did for women before they got married was put them into what's called a fattening room for 6 months. Gave them so much food so they became fat. And being a fat woman or obese woman, what we call obese now, was a sign of health, wealth, and beauty. So look at the fat rings around her neck. That used to be. Now things have changed now. We're looking for people now. Thin women has become a sign of beauty. Look at some of the models. Some of the models actually look like they need some food. Become the sign of beauty now. That has swung to the other side. Even things color. If you read some of the old English books during the Victorian era, an English woman, a white English woman, an English young girl, being tanned, having a tanned skin was a sign of peasantry. It means they went out to the farms, so the sun beat them, so they got a tan. So the rich women, or those who had what were regarded as healthy life, they preferred to be pale instead of being tanned. Now that has changed now. Every person wants to be tanned. So if some people go on holiday and sit on the sun, just get burnt, and they say, oh, because I want to look healthy. What is looking healthy now is becoming tanned. So it changes. Who knows what's going to happen in the next 50 or 100 years? Everything continues to change. But going back to what the purpose of this video was, does cosmetic surgery defile somebody? Or is cosmetic surgery sinful? Is it sinful to do cosmetic surgery? As I said, everyone has a take on it. My take on it is I absolutely have no issues with it. Because I think what defiles somebody is what comes from inside. Surgery cannot defile somebody. It is But I'll wait to see what people think about it. And this thought process continues. I'll wait for the next time as I'm discuss it further on this platform that I've just created.